Okay, welcome everybody. Thank you for joining us today on the second day of LGBT plus History Month. My name is Bradley Yacoub. I am a Senior Public Health Officer within the Birmingham City Council, and I'm also the Chair of the LGBTQ plus and Ally Staff Network at Birmingham City Council. And today we're going to be launching officially the Pride Well Summit, the Birmingham LGBTQ plus History Month Health Conference. And we have a lot to cover today, and we're going to hear from some incredible people. So first off, we're going to be doing some welcomes and a touch on our safe places approach, which will be used throughout all of our workshops and webinars across the month. And then we're going to be hearing from our keynote speakers, and we are incredibly lucky today to have a full breadth of keynote speakers. We have Sue Sanders and Lynne Nicholls from Schools Out, and the organisers and co-founders of the National LGBT plus History Month. We have Steph Keeble from Birmingham LGBT, representing the local approach and local view and the kind of the voice of authority on everything LGBT plus in Birmingham. And then we're going to be hearing from Tonkin, the Deputy Director of Public Health here in Birmingham, who's one of the co-supports and collaborators with the conference. And then after all of our amazing keynote speakers, we are then going to dive into what is the Pride Well Summit and how it came about, and then an overview of all of the sessions. So far we've got over 20 sessions booked in throughout the month, from throughout all 4 weeks of February, from partners from across the city, across the West Midlands. And we also will touch on the e-poster competition, which is still open at the moment. So we have a lot to cover. It's going to be an incredible session. And while you're listening and learning, make sure to use the Q&A function. So you should be able to access it to start a discussion, to put in questions, and we'll be able to answer them. And if you have any questions for the keynote speakers, please do put them into the Q&As, and we'll be able to put the questions to the speakers after they've completed their address. So just to touch on our safe places approach, we want all of our events and workshops and webinars throughout the month to be a safe place for everyone to learn, to grow, to share. So the approach that we expect from our hosts and from our attendees at the Pride Well Summit is respect, and it's a key element. So we want everybody to be able to respect one another, to be able to respect that it's a safe place for people to learn and to experience. To show empathy, we want people to acknowledge the feelings and experiences and identities of those around them. We want people to show care, so they create a non-judgmental, caring space for people to be authentic. We want them to support, so that's through listening, through empowering one another and supporting each other. And we want to make sure that all of our sessions and all of the work that we're going to achieve this month, but also set a precedent for what we're going to do moving forward around inclusion. So we want to include all LGBTQ plus identities and experiences, and particularly those that are seldom heard within our community as well. So as I said, you'll see this slide throughout all of the presentations and workshops and webinars that are going to be taking place throughout the month, just to keep reminding people about this safe place approach and that we're going to be trying to achieve this. So to move on to our very first keynote speaker, we're going to be hearing from Sue Sanders, who's the co-chair of Schools Out UK and co-founder of the UK's now LGBT plus History Month, and Emeritus Professor from the Harvey Milk School, and Lynne Nicholls, who's a chair of the Trustees for the Schools Out UK and LGBT History Month. And it is amazing to have them both here, because the LGBT History Month web pages, I do encourage everyone to go check them out. So if you Google LGBT plus historymonth.co.uk, you'll be able to find all of the resources, the amazing historical people that have taken place, particularly for the key theme this year, which is around medicine. Which is why it's hashtag under the scope. And you'll be able to find a lot of their education resources and knowledge, which we've used every year within our organisation at Birmingham City Council, particularly the education resources, which you may think are aimed towards school and education, but they're fantastic for workplaces, for staff, for everything. So do check them web pages out. But I don't want to take anything away from Sue and Lynne, because I know they'll probably cover everything fantastically. So I will hand over to you both.
Thank you so much. Really excited to be here. And it was music to my ears, you saying something about the importance of hearing voices that aren't always heard. Because, of course, that's why we set up LGBT History Month in the first place. Some of you will remember that we had 15 years of hell, thanks to Section 28, and we were invisibilized. And we dealt with an enormous amount of homophobia, both in schools and in hospitals and in universities, basically everywhere. Hate crime was horrendous. And when Section 28 finally went, it went with a whimper. And Paul Patrick, who was my co-chair at that time, the Schools Out, and we had done masses of work throughout those 15 years. We'd held conferences for LGBT teachers. We had produced resources. We had a very baby website which showed people that they could be out and proud in schools, because ironically, that law actually didn't legally affect schools, but my goddess did it. And we know, horrendous things happened in those 15 years. Trauma was caused. Even people attempted and some succeeded in committing suicide. So those 15 years were hell. So we wanted to do something to turn things around. So we had Black History Month. That was something that was around and people knew. So I thought, well, why don't we have LGBT History Month? So Paul and I plotted together and we worked. And eventually we managed to launch it in November 2024. And the very first one was in 2025. And we had a tiny little grant from the Department of Education at the time, which caused furore. There were questions in the House of Commons. Why was money being spent on this? There is actually a wonderful clip of Paul having to defend LGBT History Month and the language that we were using, like trying to visibilize us. And the Today program was saying, you're making language dreadful. And we continue to make language dreadful because we come up with new words, one of which, of course, is usualize, which I'm hoping you all use, because who wants to use normalize, which is a really problematic word. So 2005, we had our first LGBT History Month. I thought if we had 10 people, 10 events around the country, we'd be good. We had over 100. People were absolutely ready to go. And it's just been wonderful. We, as a very small group, over the years, we've been a tiny little group who have just made sure that month is there. As soon as websites were around, we started putting things up. And one of the things that we did, which is why I'm harking back to what you were saying, Jacob, about voices, was we put on the website, the word intersectionality wasn't around then, but I wanted it to be 100% clear that we were talking about the whole of the community. So we had this long list. LGBT people are Black, white, Jewish, Gentile, employed, unemployed, etc. And we just put them all up there so that if we forgot somebody could come along and say, oi, and we could amend it and recognize, well, why had we forgotten that group? And in fact, when we launched LGBT History Month, I had 13 people on the stage, 3 of whom were trans people. And that was back in 2005. And I look back with pride on that, given what we're facing at the moment with the phenomenal anti-trans attacks that are going on. So over the years, we've had various different people in the committee who've come up with brilliant ideas and adapted and made things happen. So we came up with the idea of a badge, which is an incredibly important way that we fund the month. Every year we have a different theme, which was somebody else's idea. And we link it to the curriculum so that every year we have a whole batch of new resources. We learn about new people every year. We have to start thinking, okay, and do hurried research. Made much easier now that we have the internet. I mean, back in the day, it was much more difficult. And of course, LGBT History Month itself, I have to say with pride, has woken up the cultural organizations like our museums and our libraries and our universities. So back in the day, it would have been very difficult to have gone to a National Trust place or a museum to actually see the word lesbian or gay or bisexual or trans. There'd be wonderful euphemisms like longtime friend or secretary or, close partnership. Now people are being much more upfront, and I'm so proud of that and so pleased that that's happening. There's been so much work done all around the country, and if you go on our website or if you look at LinkedIn or Twitter or Facebook, you'll see there are literally hundreds of events around the country, of which obviously this is a very important one. And people have just run with it, and their imagination is phenomenal. And I think it's one of the things about our LGBT community is that we are very creative. And when we have to battle and challenge, we do so with a sense of humor and creativity. And I'm so proud of our community for that. So thrilled that you're taking up the cudgels, as it were, of making LGBT History Month your own in Birmingham. And I can see some good friends who are on the line, some of whom all came from Southwark. Southwark. Lynne was a Southwark woman. I was a Southwark woman. Justin Varney was a Southwark man. It's really interesting how, a lot of us were there. So bless you for all the work you're doing. And I know that there'll be lots of more resources coming up on the website. And have a brilliant month, and I'm happy to answer questions if you've got some. And I'm going to hand you over to Lynne, who's going to be much more specific about 2024's themes and ideas.
We have Sue and Paul to thank for the fact that we have this glorious month in which to look at different areas of LGBT history. And what Sue said is true. We do have to do loads of research, and we research far many more people than we can ever cover. So each year we pick 5 people, and we want to have LGBT plus people who have done amazing things through history, but also show a really broad range of people and skills. And medicine was the theme that it was actually, some years it's really difficult to pick the theme, and it is a debate stroke argument for a very long time. But this was pretty much, we needed to have something on medicine. We've had such a complicated relationship as LGBT people with medicine, and we still continue to have some complicated relationships in medicine and some health inequalities today. But yet there's so many LGBT plus people who work in medicine and who have always worked in medicine, kind of have shaped medicine and healthcare and do absolutely phenomenal things. And so we wanted to make sure that we shine a light on that history, because not many people know that. And so this year we picked 5 people. So we picked Sophia Jex-Blake, who is a phenomenal woman, who in the late 1800s, early 1900s, is the reason really we have women doctors, one of the main proponents. There was a group of women together, and she actually founded 2 medical schools, one in London, which was actually named after Elizabeth Garrett Anderson in the end, and one in Scotland. And she became part of the Edinburgh Seven, where there was actually a riot for medical students throwing things at 7 of them trying to go in to sit their exam. Can you imagine trying to go in and sit an exam where you've just been held loads of stuff out before and you're worried if you were going to get in there? And eventually she had to actually finish a degree elsewhere. And then she set up a dispensary, lived with her partner through her life, who actually wrote an autobiography. So far from it being hidden, it was very much out there at a time when you wouldn't have thought that could happen. And last night you were at
I was at the Royal Physicians College, and they had some wonderful original documents. And I actually held, and there's a photograph that we've put on Facebook and I think on Instagram of the book that her partner wrote about Sophia Jex-Blake. And there were some other really fascinating documents, including her thesis, and also some information about another person who's Lynne's going to talk about. So people are finding the archives, and it's so exciting to actually handle them. Normally they're under glass cases, but I could pick it up and look at it. It was wonderful.
And I think for Sophia as well, one of the major things for me was, as somebody growing up in Yorkshire in a little village in the middle of nowhere, at a church jumble sale, I found a book called Walls of Jericho, which was based on a TV series about Sophia Jex-Blake's life. And it was the first inkling for me that, there's another option out there. And so it was really fundamental, I think, for me becoming who I was. And then we had Cecil Bothwell Clarke, who came over from Barbados in just before the Second World War, and studied at university over here, became a doctor, and then set up practice to be a GP in Elephant and Castle, and was so committed to his patients that even when it was being bombed and everywhere else was being bombed out, continued to be there for his patients. And his partner was his secretary. So they lived openly together, but as his secretary. He also was the first medical district officer for London, and did phenomenal work overseas as well. And last night you were able to see an article written about him that he wrote himself, talking about the need for doctors in Ghana and how they needed to be of good standing, and they needed to be, not riffraff or something. Not misfits. They wanted really, really decent people.
I'd love to tell Ghana, who have just passed these horrendous bills against LGBT people, that they've got a black gay man to thank for having a doctors in Ghana. They wouldn't be, would they take that on the chin? No, they wouldn't. But there you go.
So it's an amazing, phenomenal story. And then we go on to Margaret Stacey, and Margaret Stacey founded an entire field of sociology called medical sociology. It didn't exist before Margaret Stacey, who did absolutely amazing work, especially looking at how children, looking at the wider picture of how children's experiences of medicine were there. And I think that's really important. On a personal note, my mother was, as a child, ended up being away for 6 months from her parents and not seeing them at all. And that impact it must have on a small, and it definitely did on a small child, was just appalling. And part of Margaret's work fostered a change in that process and a change in how children were treated within hospitals, among many, many other amazing things. And then we have Ewan Clark, who, well, Ewan's story is amazing. Ewan is from Scotland and knew he was a boy from a young age, and were able to access treatment because they were from a rich family, a well-to-do family. They were able to access treatment in different countries and went through the entire medical training as a man. And when they actually practiced, they came out and were able to change their birth certificate, and they did it by putting it in the newspaper article, and it was helped by the local sheriff, and they were taken through from all the local people completely took them to heart. There wasn't any issues, and then they married, and in the end there was a big court case, and this is why the story came to light. We would never have known the story, but this court case came to light over inheritance and the fact that they wouldn't inherit the baronetcy. And it went to court, and it was for 3 years in court, but they won because it had to be passed to a male heir. But they still won that case, which was amazing. And I think it really shows that trans people have been here for a very, very long time. Also, he worked with German prisoners of war because he could speak German, and helped, was a medical officer for German prisoners of war as well. And our final person is Cherry Valentine, George Ward, who people who are fans of RuPaul's Drag Race will have recognised them, I think, from that. They also did a series on television about the traveller community. But they worked as a mental health nurse, and also specifically with Huntington's disease as well. And during the pandemic went back to nursing because they felt so strongly that they wanted to go back to it and took a pause in everything else that they were doing, and really raised awareness of their community. And sadly, it's been a year since they've passed, but the work that they did to raise mental health nursing, to raise the fact the traveller community and people can be LGBT plus in the traveller community, was just phenomenal. Clark also, going back to Cecil Belford Clark, he also had Clark's rule, which was for medical actual dosages for children's medicine. So you wouldn't actually have dosages for children's medicine without them. So these 5 people, there was hundreds to pick from, but these were the 5 we chose, and we've got videos about them on the website. And each day we will be putting out about other people and people currently working in the medical profession. And we will be highlighting our complex relationship with medicine, especially because we've gone from being hidden within medicine to being seen as a disease, to being seen as something that needed to be cured, to then an AIDS pandemic, before finally getting to a point where being accepted as human beings, with access to healthcare, and then with lots of changes that followed that to give us access to healthcare, and things are so much better than they were. And we really have to acknowledge that journey, and really the rights and the change in that journey, if you look at the whole span of time, was quite quick. And yes, we still face health inequalities today, and the statistics are quite disturbing when you look at it, especially for the trans and non-binary community. But also if you look at the fact we still can have conversion therapy, which actually affects the ACE community more so than many other communities, which is there. You also have other issues around, especially the bisexual community as well, with having much higher rates of needing with mental health. And that's not because of being bisexual that they're having high rates, it's how society is accepting them. So it's one of those things where it's very patchy, the service you receive. There is lots of statistics about how comfortable people feel in medical care, and there's lots of direct examples of discrimination, and there's lots of examples of amazing practice. And if you think of the wider healthcare piece, especially in older healthcare, because my other world is in housing, and you think of the link through and that you kind of your journey, we're not good at planning for lifelong housing through. And it means that if you're an LGBT person, the provisions aren't there, the staff are not always trained, and you end up going back into the closet, or worse, being directly discriminated against. And that, and because all the laws have changed, not all of them, but many of the laws have changed, and because it's seen in a very different way, you're going from people who have lived openly out to then having to go back into the closet because they fear for their safety. And that's an area that really needs to be addressed. There's also other health inequalities because there's a large proportion of LGBT people are homeless, especially among young people, which, you know, having a stable home, having a safe school, and having healthcare are kind of the pillars that you need to be able to thrive in life. So this is why we really wanted to raise the attention of it, especially in the current climate of very anti-trans and rhetoric. It's very akin to how Section 28 was, rearing its head again, really. And so for us, for LGBT History Month, we just wanted to say thank you to all the LGBT plus people in medicine and healthcare who are out there every day doing very challenging circumstances and doing amazing jobs. And they've shaped it. They've made the changes and really haven't been highlighted enough for the work that they've done to give us the services that we have today. So we both really wanted to have a big thank you to everybody.
Yeah, absolutely.
And whatever you do this History Month, whether it be look at medicine and healthcare, which is great because your programme's doing all of that, whether it be looking at well-being or something else, or just learning something about history, my challenge to you is to learn something new and then tell somebody else about it. Because as LGBT people, often we don't know our own history. And our history is not really included in school. It's not really there in the mainstream. So actually, the more we share the stories and the things that we learn at History Month, the more everybody will learn more. And that's really, I think, all we wanted to cover today.
Sounds great to me. But hopefully we'll get some questions. Yes.
Thank you. Yes, thank you both. And it is the importance of the LGBT History Month. The reason why I'm particularly quite passionate about it is, you are right, the fact that we don't learn about our own history in school, or actually for a long time we barely learned about it online or in the media. It was so hard to come across, and then you'd find these resources that your organisations put together, and you find out about, I mean, particularly if you go back for all the years that are on the website as well, and you find out as far back as stuff like the Molly houses, you find out around key figures from like the 1800s that you would never think, you know, our identity was all the way back there and visible. And it is incredibly empowering to know that LGBTQ plus people have been here, they've been shaping the community and the world around us for so long. So I definitely encourage you to go onto their website and read up about this year, but all of the previous years as well, and access the videos and the education resources. And particularly on the health and medicine, and Lynne, you touched on this around the wider determinants, and it's why the Public Health Division was so eager to be part of this, was this need to look past just the medicine. And if you are interested in the medicine and the history of LGBT medicine, add Dr. Justin Varney on LinkedIn. He did a great post around the passage from invisibility to being considered a mental health condition to then now where we are and the amount of work that still needs to be done. But the wider determinants element is so important, and it's why, you know, we've commissioned work around the community health profiles, which look at the many angles of what affects the LGBTQ plus community, around housing, around health inclusion and services, around food and nutrition. And that's why we're running a session on queering nutrition and how that affects the LGBT community, but also how the LGBT community view nutrition in of itself. So it is looking at the wider picture and the aspect of health and medicine in all of its many aspects, when realistically we say health and medicine, it's everyday life, because everything affects our health and well-being. So it's so important to look at it. So I do encourage you to check out the website. Make sure to get a badge. I've got a badge, and all of the webinar and hosts this year will be getting their badge as well for making sure for taking part. but also you'll be able to access their social media resources, so hashtag under the scope, and you'll see on my screen the logo is there as well, but also in the slide deck you'll see the logo. So if you have got a question for Sue or Lynne, do put it into the chat. But just a question that's popped into my mind for you both is, so from a national point of view and the work that you've done, and you've touched on some of the worrying things that we've seen coming up recently, and the worrying kind of Section 28 in disguise. What can local authorities, or what can cities, or we can do in our city to be able to make a change nationally, or to influence, or to be able to support this activism in LGBTQ+, particularly around education and acknowledging our history?
Well, I think local authorities have, I mean, what's interesting is, if you look back in the history, there were some local authorities, and I mentioned Southwark because it was a very vibrant local authority that was out there doing useful stuff. And I think, it is beholden to local authorities to put out information, clarity, that LGBT people are, for instance, taxpayers. I mean, the whole attack on Section 28 was, we're wasting money on LGBT people. Well, excuse me, we've been paying our taxes. And recognizing our human rights, supporting the teachers, supporting people, supporting the shift that some teachers are making to be inclusive of LGBT issues within schools, making clear statements that, LGBT people from different countries, from different ethnicities, disabled people. I think one of the things that I'm passionate about is that you can't just tackle homophobia on its own. You've got to tackle racism, disableism, misogynism, and everything else. If local authorities are clearly making that point, and there's been a massive attack on equalities and issues at the moment. I mean, I know the hospitals are, the Gov is talking rubbish about wasted money on equalities within the National Health Service. Stand firm. Make it clear that this work is about human rights. It's about delivering service to everybody, that you can't pick and choose who you give your services to. It is the entirety of the population. And local authorities were doing some great work, which is one of the reasons why we had Section 28, because Margaret Thatcher was so cross with them. And one of the, the places that in London that was an absolute beacon of exciting work around LGBT issues, black issues, disabled issues, unemployed issues was County Hall, Ken Livingstone. And he would put the most wonderful banners across County Hall that Margaret Thatcher would have to see every time she went into the Houses of Parliament. And what do we get? We lost in the London Education Authority, and we lost the GLC because they were doing their job. And I would say to all local authorities, do your job. Make sure that your services are for everybody, and do that work, and do it publicly. Make sure that people know about it. I can remember the moment when I saw the most amazing post on a lamppost in Southwark, which was talking about hate crime and homophobia. And that was just phenomenal, that I was being recognized, that crime against us was being recognized, and Southwark wanted to do something about it. So being public, doing the work, do the work that local authorities are supposed to do. Give services to everybody. Thank you.
I'd say as well, it's as an individual, there's a lot you can do at the moment. So there is a guidance out at the moment. You spoke specifically about inclusive education. There is a draft guidance on how schools will deal with trans and non-binary pupils. And that guidance is in a consultation phase, which ends on the 12th of March. We need as many people as possible to actually put in their thoughts on that consultation, because it's not fit for purpose and is likely to be very, very harmful. It stifles the ability for teachers to tackle bullying. And I think if organisations are really strong on hate instances and on bullying and tackle those things, then a lot will change. And not backing down and actually saying, look, holding the hands up, going, this is what our pockets are, this is what we need to deal with, and being really brutally honest about it and having that reflection, because you're serving the whole community, as Sue says. The census for the first time included LGBT plus people, not all of us, but most of us. And so you actually have a good idea of how many LGBT plus people you may have in your services. That doesn't mean if you don't have any LGBT plus people, you shouldn't, have services that are accessible for LGBT plus people, because you never know. But it is the case of if you do have a large proportion, then you should definitely be doing something and making sure you have those. But remembering that we're not all one group. We are very different with very different needs. One of the things that so frustrates me both in education and in housing is the lack of understanding that there is an LGBT housing need, that there is particular education needs, and none of which are being met. Because it's almost like we don't want to look at the problem, because if we say there's a problem, we have to do something about it. So I think you're being incredibly courageous this month by really focusing on this and seeing what you can do for the wider picture. I think it's definitely about being joined up. We're all strapped for cash. It's definitely about what can we do collectively, not individually. I mean, there is individual stuff, but I think collectively, from the point of view, you're stronger with a group of you. One of you may have a resource that the other one hasn't. And actually, looking also when you're looking at health and well-being, you have to look holistically, because it's not just one thing that will impact that person's health.
Exactly.
And if we looked at problems holistically in many areas, we would probably find that we get better results.
Indeed.
Thank you. So we've had 2 questions into the chat. Sean, I'm going to hold your question for when Joe comes along, because it feels so. Heads up, Joe. And Steph, just to let you know as well, I'll probably ask Justin's question to yourself after your speech, but just to put Justin's question for you. So Justin's asked, how do we reconnect as a community with activism? It feels like we need, as a community, to stand together more strongly. So have you got any thoughts on that?
Yeah, we've got thoughts. We will probably tell you the thoughts, but we're not allowed to tell them publicly. The theme for next year is going to be activism for that entire reason. So we've had quite a lot of discussions and thoughts on that. And I think it's about a new way of activism as well. And that wave of, sometimes we can sit back and think that rights are always going to be there, that we've hard fought for them, and that means they're enshrined in stone and we're always going to have those rights. And I think as well, is if you're living and breathing within the community, you see it happening all the time. But if you're not, you don't. It doesn't. You don't. And it's about that education piece. It's about having those conversations with people so they understand, because often they'll be like usually absolutely appalled that things are happening, but just have no idea because it's not in their frame of reference for their world. So yeah, I think there's definitely...
It's definitely education. And I think one of the things that having been doing this now for nearly 50 years is grabbing all the tools. I think what's so exciting now is that we've just, because of this whole horrific guidance, and the government can't even use the word trans, which is just outrageous. It visibilizes them totally. We are using all the tools. We're using the network. We're using Zoom. We're using all the ways of being able to communicate. And I think, as an activist back in the day, it was telephone trees, and it wasn't mobile phones at that. It was using photocopiers which died after 50 pieces. I mean, we still did the work, but in some ways it's a lot easier now. And of course, in other ways, Twitter can be a godsend, and it can be horrendous. So you have to be, as an activist, I think that it's crucial that you find ways of getting good support. I mean, I am very lucky in the sense that I've had my partnership with my partner is 36 years old, and she's there 100% of the time supporting me. If you don't have that support within, total intimacy, then make sure you have a group of people that look after you. Burnout is something that can happen. But I think, as I was alluding to before, one of the things about our community is that we are very creative, and we do have a sense of humor. And I think, using our creativity, channeling, that's the word I'm looking for, channeling our anger is so important, that we can use it to keep us going, that we don't turn it in on ourselves, that we do some work about our own internalized homophobia, racism, misogynism, and then can get out there and work with others. And I think, being cooperative is crucial. You can't do this work on your own. You've got to join hands together and use everybody's different skills. And then we can be very powerful and we can make change.
And I'd say there's lots of ways to be an activist, because I was asked to speak at a panel at work a couple of years ago going, it's because you're such an activist, Lynne. And I was like, I'm not an activist. Because in my head, an activist was somebody that abseiled down the Houses of Parliament and chained themselves to things and did all of the rest of it. So I was really like, but I'm not. And they then spent half an hour trying to convince me I was an activist. And it did make me reflect on there is many different ways of activism. I just really talk openly about my wife because I love her to pieces, and I always have. And I didn't realise that in its own right was a force of activism, because if somebody said, what were you doing at the weekend, or what you were doing ever, I would just say, my wife and I did X, without batting an eyelid, to be honest. Slightly more cautious in taxis, to be fair, because there's some interesting conversations that come off the back of it often. But I think there's many, as I say, lots of different ways to be an activist, and there's a quiet form of activism. There's a form of activism which really means taking to the streets form of activism, and there's that in the background activism, when really what you're doing is pulling people together and pulling communities together to work together in a space, and holding that space for people to learn and grow and expand, because we all have our faults, we all have areas that we need to work on ourselves, and I think sometimes there is the confrontational type of activism, but there is another type where you hold space for someone to grow. And I think that there's many different ways to get there.
Brilliant. Thank you both. And thank you for the heads up around next year as well. So everyone can already start planning.
Because we won't officially announce it till November. So we'll deny all knowledge.
But I suppose it's a good opportunity to remind people. So if you do go onto the LGBT plus History Month web pages, and you work with young people or children, they can get involved in the submissions to be able to create the badges and to be able to influence how the design looks, which is incredible. And you can actually see the story of the person who came up with the design for this year. So do check that out.
Alex is brilliant. Yeah,
so,
I mean, it's every June. So every June we do that's from the past 3 years. It's the badges evolved in many different ways, but we have a schools badge competition that's open to primary schools, secondary schools, and youth groups. And they design the badge, and the final winner badge gets created into the logo that you've got on your screen, into a physical badge. They get a prize, and the runners-up do as well. So even this is like kind of a winner of the primary category and secondary category. And we have had people from different year groups win. It hasn't always been the older person or the most polished design. It's been often the most creative.
Brilliant. Thank you both. If you can stick around, that'd be fantastic. But I know both of you are very busy, considering it's only the second day of LGBT History Month, and you're
we're going to have to dash because we're going to Birmingham randomly. So we've got the LGBT teachers conference all weekend in Birmingham. So we'll actually have to dash because we need to go and get
ourselves ready.
Okay.
But thank you for the time, and I'm really sorry we're going to miss hearing you live, but you'll send us the recording so we can listen to all the wonderful things that other people are saying. It's great to see you, Steph. And I know there's some other friends on the chat, so I'm sorry to miss you, but we'll catch up with you.
Brilliant. Thank you both.
Thanks, Sue.
Bye.
And that brings us up very nicely onto our next keynote speaker. So our next keynote speaker is Steph Keeble, who is the director of Birmingham LGBT. And Steph has been kind of a leader in this city for over 25 years. I mean, last year you was recognised by Aston University.
Sorry, Bradley, I haven't lived in this city for 25 years, so it's not 25 years. I've been working in the sector for about 14 years.
Oh, okay, sorry.
Not wanting to correct you, but I don't want you to give me credit where it isn't due.
No, that's thank you for correcting me. So 14 years, but last year you received a honorary doctorate from Aston University, which is where we got the photo from, because I thought, got to get that photo up there. But yeah, no, Birmingham LGBT is an exceptional organisation within the city that has been kind of the cornerstone of most of the services within the city when it comes to supporting LGBT community, whether that's around mental health, sexual health, access to services, connecting communities together and opportunities. And it is great to have Steph here to be able to talk more on what you do and who you are and on Birmingham LGBT and be part of the conference. So I will hand over to Steph.
Lovely, thank you. And Yes, so I'm here and Bradley has given me a bit of a remit. So I'm going to start off talking a little bit about what we do, then cover why I think LGBT History Month is important for the community, and finish with a challenge around what I think the city can do to address LGBTQ plus health disparities. So to start with, I'm Steph Keeble. I'm the director of Birmingham LGBT, and I haven't been in Birmingham for 25 years. I've been here for 14 years. I was looking at my diary the other day and thinking, gosh, where's that gone? It feels like 5 minutes since I moved to the city. And I'm currently the director of Birmingham LGBT. And Birmingham LGBT opened the first LGBT health and wellbeing centre in England and Wales, aiming to address health disparities in 2013. I actually met Sue 12 months earlier at a conference when we were announcing we were going to do this, and she was terribly excited. So it was lovely to see her again. So we opened in 2013 with the equivalent of 3.5 full-time staff. We had me, David Viney was the centre manager, 2 part-time older people's workers and a part-time volunteer coordinator. And today we have 32 members of staff covering a range of services. We operate from an asset-based model. We know the health disparities we face, we know the reasons why, and what we're aiming to do is look at the strengths in the community and build resilience and look at how we can address some of those health disparities. So services we currently offer, we have sexual health service in partnership with University Hospital Trust Birmingham as part of the umbrella sexual health service, covers Birmingham and Solihull. That includes 2 nurse-led clinics a week, which the NHS deliver. And outside of those hours, our staff can do HIV point of care tests and support with what we call assisted self-sampling. So they will do a screen with people, they will take their own samples, but we'll give them some advice on how to do that if they need that and how to get blood out. We'll then send them off, and as part of the assessment we can then look at any other support needs and refer into other services either internally or externally if needed. We also have a partnership with CGL to deliver substance misuse services. This is relatively new. We have 1.5 part-time workers working on that. Part of what they've been doing is training CGL staff across their system. They've trained 270 staff in inclusive practice with LGBT people, and also some of the issues that are coming into the service. It's mainly chemsex that we're seeing at the moment in terms of the substance misuse patterns that are accessing that service. So that's the second service we offer. We have a range of domestic abuse services. Our domestic abuse services are regional: sexual health and substance misuse, Birmingham and Solihull. So West Midlands for domestic abuse services, funded mainly by the Police and Crime Commissioner's Office, and some by the local authority, some by Henry Smith. So we have 3 LGBT culturally competent IDVAs, so independent domestic violence advocates, who will carry out risk assessments and safety plans and support till risks reduce. We also have a group worker, which is funded by the local authority. A couple of years ago, Comic Relief supported us to develop the first culturally competent group work programme for lesbian and bi and trans women in the UK. At that point, there may be something else now. It was evaluated by Durham University. At the time, they believed it was the first intervention in terms of LGBT domestic abuse that had a proper evaluation. And the local authority, we got a grant from them to run this. It's currently running. We're currently delivering the Rainbow Project to 10 lesbian, bi and trans women. And we have somebody looking at updating the modules, and we will be running it for gay, bi and trans men following this. So we're really proud of that project and what it's delivering. We also have mental health services, so a range of mental health services, including wellbeing support. We're currently running a number of what we call self-help or self-care wellbeing groups, funded by the Integrated Care Board, Care System, Fairer Futures. So that includes groups for LGBTQ people. They're 6 weeks. They're run by our counsellors, and they look at self-care and strategies people can deliver. And they're just about to run a group for trans young people, was piloted with a grant from Public Health previously. So that's for 18 to 25-year-olds. Again, same principle, looking at where people are at, looking at self-care, looking at some strategies people can develop. We're offering these currently to people on, not the trans group, but the other one, to people on our waiting list, because like I'm sure many services, we have a long waiting list for therapeutic counselling or talking services. We have what we call a trans inclusion project, and as part of that we have trans-specific counselling. Again, this is West Midlands. We have a trans wellbeing support worker, West Midlands. Support work is much more practical. 6 weeks can continue, but it can support with things like advice around depots, practical support, anything that people present with, really. They'll get a needs assessment and some goal setting. And we also have LGBT counselling. So we have counselling in the city. We've got a little grant to do some work in Sandwell at the moment. So 2 waiting lists, as I said, quite long waiting lists. There's a growing demand for culturally competent affirmative therapy for people, and that's really important because it addresses people's mental health and well-being needs. We have services for older people. Our current services for older people include wellbeing support, which is funded by the Masons Foundation. We also have some funding from the local authority, prevention and promotion funding, to look at putting on events. So we are currently running a weekly coffee morning for LGBTQ people who are 50 plus, and we'll be looking at co-producing with them a range of activities and events that meet their needs to challenge isolation, which we know is one of the detriments of poor well-being and poor mental health. And alongside that, we have an NNS worker, Network Neighbourhood Schemes, which aims to support the community-based activity across the city, not just for older people, so that networks can develop, or activism or sports or social activities, so that people can take, and again, asset-based, so people can support each other. So that's part of that team as well. We also work with young people, currently trans youth. So we have Emerge. We set this up, probably in about 2015, with a small grant from Birmingham Pride at the time. And we set up a trans youth group because there wasn't anything for trans young people. The nearest was Manchester. And at that point, and I believe they still are, out central, we're working with LGBTQ plus youth. So we don't want to reproduce what other people are doing. We want to meet the gaps. Emerge is currently working with 35 trans young people. It's a very difficult time for lots of our trans youth, which has been alluded to previously. So then, that's a weekly group meeting. They do some activities, sometimes go to the cinema, they go to Pride, went to Brighton Pride with Gendered Intelligence last year. They also sometimes just want to meet each other and have some peer support, and we can offer some wellbeing support as well as part of the group. Isn't currently funded. We did have Children in Need funding. They didn't give us continuation funding, even though we delivered all of the outcomes. Don't know why that is. We will reapply, but we're currently funding it out of reserves because we can't let that service go. And there is a crowd fundraiser out there if anybody wants to donate. Not that I'm here to plug for money. Outside of that, we offer a range of events and activities, including Shout, Birmingham's Festival of Queer Culture. We've run a number of heritage projects, including Gay Birmingham Remembered, Gay Birmingham Back-to-Backs, Nightingale 50 and Young Roots, which is a project where young people got some skills around filmmaking with a filmmaker. We didn't just let them loose with a video camera, and filmed people's coming out stories. We also have a number of what we'd call more social support groups. Last year, during the cost of living crisis, we set up a warm bank. We didn't call it that, we called it a warm welcome space, but we opened 3 days a week and offered people blankets and hoodie blankets and flasks of tea to take away. When the weather got better, we stopped doing that 3 afternoons a week, but we did continue with what we've called the Rainbow Social on a Friday afternoon, because there was clearly a need for that space. We also have a wellbeing stroke support, peer support group for men that meets once a month, and we have a group aimed at South Asian people that meets once a month. Those are groups we run. Alongside those, we give meeting space to a wide range of community groups, including trans groups and other groups, to meet at the centre, so that there's space for them. So that's a sort of summary of what we do and the services we offer in the city. In terms of why is LGBT Month important? So the first thing I'm going to pick up on, it's been mentioned before, is visibility. Tell you a little bit of a story. When we were first moving, when we first made the announcement, because when I first started working in the sector, I started working for the consortium as a West Midlands worker, and then got the job for Birmingham LGBT. It was Birmingham LGBT Community Trust then, and everybody we spoke to wanted a community centre. That's what we were saying. So I thought, okay, let's see if we can do this. And when we made the announcement, we were due to we were going to open, which is Holloway Circus. We got a lot of backlash. We got a lot of people saying, why are you moving there? Why isn't it in the village? One of the reasons was it was too expensive in the village, but also, and this concerned me a little bit, why are you there? Because everybody will be able to see it. It's visible from every road into the city. And I thought, absolutely. And I actually wrote a blog called Signs and Symbols and Their Importance to the LGBTQ community just before we opened. And what I said in that blog was, for a community that's fought for its right to live, to love, to exist, why should we hide? I was very proud of the fact that that sign could be seen from every road into the city, and I still am, because just seeing it, if people have never walked through the door, they know there's a space for them. We are visible, we are here, we are queer, and we're not going anywhere. It has had its downside in recent years. Up until 2016, we didn't receive any hate crime at all. We've had a window smashed 3 times. Last LGBT History Month, we were greeted with something engraved in our door which said "fucking perverts." I just told the staff to cover it with a rainbow flag until we could get it sorted out, because we're not going to hide. And I think that visibility is really important. It's really important for our youth. It's really important for our well-being, that we can be who we are. It's really important that we're recognised, that we're visible, that we're not hidden, that we're not marginalised and written out of history, not in the past, not now, and not in the future. That is really important. LGBT History Month is also really important because we need to recognise that there are many, many countries in this world where it's still illegal to be LGBTQ, where people are still being persecuted and sometimes murdered just for who they are and who they love. We talked about young people. LGBTQ young people make up 25% of youth homelessness because their parents are still throwing them out of home because of who they are. I don't get it myself. I don't get how anybody could reject their children because of who they are, but it's happening. And it's not just on a global scale. It was referred to earlier. We're in very toxic times. Things have changed. I just highlighted some of the hate crime we've experienced as an organisation, and that was just things like windows being put through. First time in lockdown, I thought it was a bit of graffiti. Second time, I thought, okay, we're being targeted. Nobody else has had their windows through. We've had other things, but I won't go into those. It is a difficult time. Hate crime is increasing. There is a very toxic culture of transphobia in the press. We're in very different times now to when we opened. And I think it's really important to recognise that human rights that we fought for can be taken away as well as gained. And we should not be complacent. It's really important that we're not complacent. There's a lot of othering happening at the moment. Within our community, it's primarily the trans community. There's also othering of migrants at the moment. And some of the language is very emotive, and it's very challenging times. I'm not going to say anything too political because I'm the lead of a charity. But all I'm going to say is Gary Lineker. We are in difficult times and we shouldn't be complacent. So that's another reason why it's really important to recognise where we've come, to recognise what we've gained. But actually, just because we have the equal right to marry doesn't mean that we're not experiencing discrimination and prejudice on a daily basis. And it's also really important that we reach out to the intersections within our communities and that we come together despite differences and recognise all of those voices, because at times like this, there will be an attempt to isolate and separate communities and increase horizontal hostility, which prevents community action and community activism. Finally, because I don't want to talk at you for too long, you may have some questions for me. I just wanted to answer the challenge Bradley set, which is what change action I hope to see in the city to improve the health, and well-being for lives of LGBTQ people. I could have spent 10 minutes answering this. I could have given you a wish list, some blue sky thinking. I've been banging on for years about what needs to happen, but in line with the theme of medicine, I'm going to give one challenge to the city, and it's not the city council, it's the city. I think we need a gender identity clinic in the city. The nearest one is Nottingham. Waiting lists are increasing. It's really difficult for trans people. Their mental health is really suffering, and there are opportunities now with NHS England looking at pilot models around the country with links to the third sector. So that's what I think we need as a top priority. That's my challenge to the city. That's it for me, but happy to take any questions either now or after the next speaker. Thank you. Thank you for listening.
Thank you, Steph, and thank you for the insights. I mean, I'm very impressed that you managed to get all the service and all the provision into that short space, because there is so much. But I do encourage people to check out Birmingham LGBT's website, so you should be able to see it in the Q&As now, to be able to find out more detail about everything that Steph's covered, to be able to find out about the centre itself, but also how you can get involved or how you can support. And it's just so much information on there. But to put a question to yourself. So it is fantastic that you mentioned around the active othering and what we're seeing within the LGBTQ plus community, but I think generally across the kind of space of EDI is this kind of separation. It was a whole reason why we have communities about bringing together, so we were more powerful together rather than dividing us. So Justin asked the question in the chat, how can we as a community be more compassionate and inclusive of each other? How can we build and kind of challenge this othering that's happening at the moment?
I think it's a really interesting question, and I think the word compassionate is really important, because I think sometimes it was like the question around activism earlier, and somebody answering that there's all sorts of different ways to be an activist. There are. So I think sometimes it's about being compassionate with each other, but I also think we should be a little bit more compassionate with ourselves sometimes. So I think sometimes people don't value what they offer, and sometimes just a very small act can make a very big difference. I think one of my pieces of advice in terms of coming together and being more compassionate with each other is avoid Twitter. Don't go on Twitter, don't read it, don't look at it. We only have it for work. I try to avoid it. Some of my friends have had a hideous time on there, particularly trans people. So one of the things you could do to be compassionate to yourselves is to avoid Twitter. Social media, I think it was referred to earlier, is amazing. It's an amazing tool for activism, for getting a message out, but there is a downside of it. And one of the downsides is the immediacy of it. You could read it at 10 o'clock at night in your front room, where it's calling you all sorts of things, and you know, the advice you'd always get is don't respond, don't get into a dialogue with hate, but you've still read it and you've still been affected by it. I think we should be reaching out across difference, and that's not always as easy, because sometimes that means we need to look at what we need to learn, because we can't be the answer to everybody. We may need to own some of our positions of privilege, and where we're at and how we got here, what our histories are. We won't always know each other's stories or histories. We might make lots of assumptions about people. So again, I think communication is key. Check out with people. What do they need? Do they feel included? I mean, one of the things we got a lot of feedback from Christmas Day. We opened Christmas Day, and one of the things we got in terms of feedback was what felt welcoming was people were greeted and people were introduced to people. So just a little thing like somebody going along and saying, how are you? Because it might be their first time coming along and they might not know anybody, and that can be a bit intimidating. So just to recognise sometimes as a community that if people are coming to groups and activities and events, not everybody knows each other, and sometimes the people who are quieter might be, you know, just needing somebody to come up and chat to them. I think there is something around listening to difference, but sometimes actually not being. Sometimes what people do is if somebody doesn't do what they think is right or what they think is needed, people can be very defensive and attacking, and I understand where that comes from. Whenever we deliver training, what we try and do is develop a safe space so people can ask some of those questions, and sometimes some of their views are challenging. One of the sessions we look at is microaggressions, because what we want to do is raise awareness of unconscious bias so people can change it, because 95% of the people we train want to do a good job. They're not intending to be homophobic, biphobic or transphobic. It's unconscious bias they're not aware of, and being made aware of that can sometimes be uncomfortable. So the other thing I'd say is be prepared to be a bit uncomfortable and be prepared to be self-reflective, but from a place of empathy and compassion rather than shouting and defensiveness and attack. Because if we attack each other, that's what the oppressor wants. That's what the people with power want. They want horizontal hostility, because if you have horizontal hostility, you don't challenge the vertical hostility. And actually, we have more in common than we have that divides us, because we will all face the same oppressor.
Brilliant, thank you.
Not sure if that answers it.
I believe it does, and I think that you finish in a fantastic place, which is that we do have more that unites us and separates us, you know, and I think we have to hold on to that, and we have to, I think, bring that back to the forefront, that we are a united front.
And be happy to celebrate who we are as well. Be visible and proud. Yeah. Because that's what LGBT History Month and that's what Pride Month are for. But we should be doing that 365 days a year.
Yeah. Brilliant. Thank you, Steph. And if you can stick around in case
I'm happy to stay. Yeah.
Brilliant. Thank you. Okay. So that brings us over to our final keynote speaker before we dive into more information around the conference and around what we're going to be covering throughout the month. So our final speaker is Jo Tonkin, who is the Deputy Director of Public Health at Birmingham City Council. And Public Health are one of our co-collaborators in conjunction with the Proud Rainbow City Partnership and the Equality and Cohesion Division, who have supported the conference and are doing many of the workshops and webinars that are taking place throughout the month. And Jo is going to give us a bit of an insight into public health and its place here. And I know Justin's also on the call as well, who's been putting into the chat. Justin's the Director of Public Health. So hand over to you, Jo.
Brilliant. Thank you so much, Bradley. So hello, everyone, and welcome for all of those of you who are joining live and also catching up on the Healthy Brum YouTube account. It's clearly an honour to be here speaking alongside Sue, Lynne and Steph, who've been so instrumental nationally and locally in ensuring that LGBTQ plus people are heard, that they're included and they are empowered to thrive. I've already learnt so much from attending this webinar, and I absolutely commit to sharing that new knowledge, so thank you. The Pride Well Summit, Birmingham's LGBTQ plus History Month Health Conference, is a key milestone for our city, and it's an event that the Public Health Division is thrilled to support. I know that many of my colleagues are present in this space, or will be kind of logging on and watching this and the other webinars. We'll be using our new knowledge to implement through our public health practice. So this month of activity, knowledge sharing and exploration is a key driver for building the health and well-being of a system which is both inclusive and effective for our LGBTQ plus community. My own working life has been shaped by the injustices shown to the LGBTQ plus community. And as a straight cisgender woman, I had a lot to learn. I started my working life in the early days of HIV. It was a privilege to work alongside activists in the communities who, using strategies gained through the civil rights movement, organised, took ownership of the information, made injustices visible, asserted their rights as patients, and provided care and support where it did not otherwise exist. All this in the face of significant discrimination and stigma. I learnt a lot, and I believe that the health system that we have now, where the patient voice is more valued, came from those courageous actions. I later worked to improve the mental health and well-being of young people and to address the tragic increase in mental ill health amongst adolescents, and clearly the LGBTQ plus community have been particularly effective. I worked with the community to lever resources and put in place a network of safe spaces where young people were able to meet, explore their sexuality, their gender, their identity, and where they could give and receive peer support. Now, public health is about addressing injustice. And I refer to these examples to illustrate that public health isn't just delivered by me, by the division, but it's delivered by us. By mobilising our knowledge, what we know in our heads, and our passion, what we feel in our hearts, and building on and building into our systems of care relationships that are born out of respect and out of rights. Birmingham is a wonderfully diverse city with communities of experience from all walks of life, and it makes for a unique set of opportunities and a unique set of challenges. Teams from the Public Health Division will, in this webinar series, explore the Census 2021 findings. They'll share deep dives, health needs assessments, more throughout the month. But I wanted just to provide a quick insight into the 3% LGBT plus and 0.9% non-cisgender Birmingham people that we've seen for the first time represented, visible within our national census. And what that census showcased was a growing LGBT plus community for the future, with more young people aged 16 to 24 and younger adults aged 24 to 34 identifying as LGBT plus. And that's a testament to a changing and more inclusive future. But it only gave a glimpse into that community. Birmingham had the highest percentage of those individuals who chose not to disclose their identity. Sorry. So together with a proud Rainbow City Partnership and the Health and Wellbeing Board, this is the platform on which we must build. Borrowing from Sue, Lynne, the National LGBT plus History Month, it's our opportunity to claim our past, the journey of the LGBT plus community, the journey that that has been gone on simply to exist, to celebrate our present and thriving LGBT plus communities and leaders that are continuing to work and to create a future together in Birmingham that is thriving, that is inclusive, that is accessible, and for all LGBT plus Q plus communities and their health and well-being. Thank you so much for taking part today. Please register for as many of the events as you can, and I'll hand back to Bradley, and he's going to tell us a bit more about what's on offer. Thank you.
Brilliant, thank you, Jo. And yeah, thank you for giving an insight into your background. I mean, one of the network that I'm the chair of is the LGBTQ plus and allies, and it is incredibly important that we have allies on this journey with us, and they have been instrumental throughout the history of activism within the space around LGBTQ plus, and they will continue to be, because we can't do this in isolation. And it links to what Steph was saying and what Lynne and Sue mentioned around coming together, about bringing together our shared experiences, our shared knowledge, around empowering one another, and that allyship is incredibly powerful. So thank you for sharing your experiences and for supporting the conference. And I spotted that Sean's had a few responses regarding what work is happening for older adults and older people. And I definitely follow the links that Justin shared, and do check out the Birmingham LGBT's website. So Maria is one of the leads for the NNS, and is doing some amazing work in this space around older adults and Birmingham LGBT. And just to let you know that there is a conference that's going to be taking place, I think on the 23rd, that is focused on the health of older LGBTQ plus people. So they'll be bringing together people from across the field of social care and health to explore that. So there is a bit going on there, Sean. But I would encourage you to kind of check out that website that Justin shared, and Age UK and Birmingham LGBT for more information. And Jo, there's a question in the chat. So as an ally, how do you think we can ensure more public health practitioners understand the inequalities affecting LGBTQ plus communities more explicitly?
Thank you. Well, I think we need to be really kind of explicit in our commitment to being an inclusive workforce within the kind of public health division and within Birmingham City Council more broadly. I think we need to build our competence, understanding and listening to the needs and experiences of the community and communities. And kind of further to that, I think from a public health practice perspective, we need to be systematic in our assessment of the needs of this community across all of the kind of intelligence products that we do, and particularly kind of picking up that issue around the census, seeking to improve the visibility of this community, these groups, within all areas of kind of service delivery. And I think also, as an ally, I need to be open to be challenged, to be kind of called out, to be able to kind of learn in this space, as I hope I have done in the past. So I kind of share with you that commitment, and I hope that my colleagues right across the public health division stand with me in that commitment.
Brilliant. Thank you very much. Okay, thank you to all of our keynote speakers. If you do have any other questions while we're continuing with the presentation, do feel free to put them into the chat. And if we don't get to them in the session today, then we can always follow up afterwards. So, to bring it back to why we're all here today then, so a quick introduction to the Pridewell Summit, the Birmingham LGBTQ plus History Month Health Conference that's taking place this month. And then we'll also look through the 4 weeks of activity very quickly as well. And there will be links in the presentation on screen, so you'll be able to click on any of the events where it says register here, and there will be a QR code at the end, and we'll also be sharing some links in the chat as we go through. So the Pridewell Summit came about as a deliverable of the Proud Rainbow City Partnership. So the Proud Rainbow City Partnership is a collective of organisations, of key influencers and activists and leaders from across the city that came together to build a more inclusive LGBTQ plus city for our citizens. And some of the members around the room include Public Health Division, Adult Social Care, West Midlands Police, Community Safety, Birmingham LGBT, Birmingham Pride, many of the NHS health trusts that are within the city, and many other partners. And as a deliverable of that partnership, we wanted to host a series of webinars and workshops that would help to increase the knowledge and the learning of people in our city. And one of the opportunities that arose was that the fact that LGBT History Month this year was focusing on health and medicine. And we know that we want to try and increase the health inclusion and the knowledge of our around health and social care, particularly that affects LGBTQ plus people in this city. So that's where we got this conference from, the Pride Wales Summit. So if you do want to find out more around any of this, you can go on to the Pride Wales Summit Birmingham LGBTQ plus History Month Health Conference. If you Google that, you'll come up to our web pages and you'll be able to find out more about the history of the conference and where it came about, and also access more of the information. And what we wanted to do with the conference aims, we wanted to tackle LGBTQAI plus health inequalities, inform and drive the actions of the Proud Rainbow City Partnership. And many of the actions, even though we'll be focusing on health and well-being, we also wanted to focus on safety and community, on expanding the knowledge and the history and the learning about the LGBTQ plus community here in Birmingham. And you'll see a few of the sessions that are planned, and we have more to come yet that have just been sorted out. They'll be going up on our Eventbrite page when they come live. But we'll be looking at stuff that around the queerness of the museum collections and much more. We want to build Birmingham as a centre of LGBTQ plus health and wellbeing innovation, and support the National LGBT plus History Month activity and learning, and the theme of Under the Scope. And we'll be doing that through kind of 3 opportunities. So all of the webinars and workshops that are taking place will focus on 3 themes. They'll be shining the light on issues that affect the LGBT plus community. They will be celebrating or connecting with the LGBT plus community, or they'll be sharing emerging practice and learning. So you'll see this theme as you go through the workshops. They'll be looking at it from one of the 3 lenses. And we've also linked in with the ICS strategy, integrated care strategy, around circulatory disease, respiratory disease, cancer and mental health, but also the Health and Wellbeing Board strategy. And you'll see the all of the priorities there. So they're quite broad spectrum. So that's why we were talking around the wider determinants and that holistic approach to everything that affects our health and well-being. And we do have workshops and webinars that fit into all of these categories. So you can learn from everything from nutrition and chemsex to older LGBT plus health, sexual health, nutrition, mental health and well-being, becoming a peer mentor or a mental health champion, and many more. But there is still opportunity for people to get involved. So we'll be going through the ones that have been submitted so far and all of the planned events that we have for the month. But if you have got a webinar or workshop, or you've got knowledge and experience that you'd like to share, there's 2 ways of doing it. You can still host a webinar or workshop online. And if you complete the Microsoft form, one of the team will get in touch and will support in setting up all of the webinar information. So that includes the Teams link, the Eventbrite page and the adverts. And we really do want to encourage as many people from across the community and industry to be able to share their knowledge. So if you've got anything, do check out the website, scan the QR code or click the link, complete the form, and we'll be able to support you in being able to create those workshops and webinars. But there's also an opportunity to complete an e-poster. So we've got a couple of submissions already, but we wanted to extend the deadline. So we've now got till the 9th of February to be able to submit an e-poster, which can be a community project or initiative, or it can be an academic research that focuses on the LGBTQ plus, and that can be health and well-being, but it can be the wider determinants as well. So it can be something that links to housing, maybe, as that come up a few times today, but also many other areas. So if you go to the website, we've done a bit of a list to kind of get people thinking on what they can share. And we do encourage people to do this, so we'll be able to share this information on our web pages for the future. So this knowledge is available for everybody to be able to access and inform their services or their community projects moving forward. So we encourage you to submit these. If you go to the website, enter the e-poster competition, you'll be able to find out more, how to submit the guidance document, and a bit of explanation on the e-poster platform. And I'm aware of time, so I will quickly go through the 4 weeks of activity. So you should be able to see on the screen week 1. So week 1, we will be starting off with the behavioural science team. We'll be looking at the barriers and facilitators to health literacy within the transgender and non-binary communities. And they'll be doing that based off a literary research that they've done. So you can click on the link where it says link to article to find out more about the article, but they'll be going through that in their session. Then on Wednesday, we're doing LGBTQ plus sexual health with the adults team, who are one of the teams that commissioned the umbrella service, which Steph mentioned, who work in partnership with Birmingham LGBT. So they'll be exploring the LGBTQ plus experience within the sexual health services. Then the Birmingham Women's and Children's Hospital, who are hosting quite a few sessions throughout the month, so we're also supporting them in promoting their events. They'll be running a session on HIV awareness and looking at the dialogue and dispelling the myths and empowering people around HIV. And then to finish off that week, we have the nutritional implications of chemsex drug use. That will be hosted by Jason Simpson-Theobald from Nottingham University. And it's quite an interesting session. We have a lot of interest in that session so far, and it's something that maybe people haven't thought of or haven't explored. So do check out that session and register with that. Week 2. We start off with mapping queerness in the Birmingham Museum collections. So Birmingham Public Health are working with a lot of the museums and arts industries in the city. And out of that collaboration, we were introduced to Natasha Booth Johnson, who has done an incredible article. So do check out their article. It's under the same title as the workshop, so you can find out more. But they'll be running a session on what they discovered when they were doing their research into the queerness within the collection in Birmingham museums and the artwork, and the hidden queerness, and they'll be exploring that and what that is and how that's developed a more friendly queer experience in the museum space and how it can potentially work on that in the future. Then on Tuesday, we have citizens identifying as LGBTQ+, and this is from the point of the deep dive programme. So the deep dives look at the JSNAs, which is, and the ones that have been completed so far are the Armed Forces veterans, end of life, learning disabilities and dual diagnosis, and then they'll be deep diving into the LGBTQ+ within each one of those. On Thursday, we have the inclusive services, inclusive languages. So that's run by by myself, the LGBTQ+ and Allies Network, who've been putting the session together. I'll be focusing on the use of language, the power of language, and how we can make sure we can build inclusive services by focusing on how we deliver services in our language use. And then the final session of that week will be Queering Nutrition, which is from the food system team. And they'll be looking at the research and knowledge from international and national around how nutrition interacts with the community and how it affects the community. And we'll also be sharing a bit from our Seldom Heard Voices survey that we did a few years back. Week 3. We start off the session with an insight, so you get a sneak peek at the Director of Public Health's annual report, which will be published soon. But that session will be focusing on a key chapter, which is from the 2021 census data and future trends on the LGBTQ+ population. And I have had a sneak peek of that myself. It's very interesting. It's opened many questions, so it's a good session to try and attend. And then on Tuesday, smoking in the LGBTQ+ community, from the adults team who commissioned the smoking services in Birmingham, Stop Smoking Services. I'll be attending that session just to share, because I feel like I need to keep sharing it. I'm on day 16 of stopping smoking. So I am looking forward to attending that session and hopefully influencing how we can adapt services for LGBTQ+ people to access Stop Smoking that works for them and works for their community and their lived experience. And then on Wednesday, we've got 2 sessions, Health in LGBT+ Older Adults, led by the Older People team and one of our GP registrars that'll be working on that team. And it will also be just before the in-person conference that'll be taking place in collaboration with the University of Birmingham. And then the second session will be exploring the needs of gender diverse individuals with dementia. And that will be led by Phil Harper from Newman University. And it's going to be an incredibly interesting session. They're going to open it up to a bit of discourse and learning, so we can discuss and explore and have a discussion around the information and research that they'll be sharing. And do check out Phil Harper, they have an online presence as well. And then to finish that week off, we'll be exploring the challenges of addiction and its effects on the LGBTQ plus community, led by the addictions team. And they'll be exploring both addiction and also the mental health aspect that links to the ICS strategy. And then to wrap it up in week 4, which is 2 slides because we have Super Monday, because we have 4 sessions planned in for the Monday. So we'll be starting off with the LGBT plus peer mentoring and mental health champions, which will be led by R Space and Bernardo's in partnership with the Children and Young People's team. And I do encourage you to sign up to that session and to encourage others and your network to sign up to that session to find out more around the peer mentoring and mental health champion program that they're running. Then the second session of the day will be the LGBTQ plus community health profiles. And if you attend the session, you'll have the first look at the gay and bisexual profiles. The lesbian and trans plus have been published, so they're on the public health website. So if you Google them, lesbian community health profile or the trans community health profile, you'll be able to find the 2 profiles online. And the gay and bisexual will be published, I believe, in March. But they'll be giving you a quick insight into all 4 of the community health profiles, the knowledge and learning that has gathered from that, and how you can use them in your services. And I believe Birmingham LGBT were even part of putting them together, as well as many other partners from across the city. Then we have the Inclusion Health and LGBTQ+, and that'll be with the Inclusion Health team and the University of Birmingham, looking at the some of the needs assessments that they've done in the city and how that influences inclusion health. And then the final one on Monday is the mental wellbeing and LGBTQ+, and that'll be led by Birmingham LGBT, but also in collaboration with the mental health team. And then the rest of that week, we have the all-day conference hosted by Birmingham Women's and Children's Hospital Foundation Trust. They'll have 5 keynote speakers throughout that session, exploring everything from addressing health inequalities, cervical screening and marginalised groups, transgender health, clinical considerations for working with gender diverse people, gender affirming healthcare, and much more. So a full day of activity and speakers there to tune into. On Wednesday, we'll be shining a light on health protection matters with the health protection team, which always an interesting aspect, and particularly with lots of the experiences of health protection that we've gone through, whether that's COVID or the current measles situation, but also historically, whether that's around HIV and AIDS. On Thursday, the 29th, we have Spirituality, LGBTQ plus activism and mental health. And this session is being hosted by the Inclusive Gathering Birmingham, who are inclusive spirituality and faith organisation within the city. And they have brought together an absolute incredible panel of people to explore all forms of spirituality and activism and mental health in the LGBTQ+, with a New York City-based Reverend Elizabeth Edman, an Imam LGBTQ+, Al Sadiq, and a UK Black Pride Inclusive Interfaith chaplaincy, and then Naomi Rowe, who is a Jewish non-binary activist and music psychotherapist as well. So it's going to be an incredible session, all hosted by, of course, Dr. Naomi Bennett Steele. And then we have our closing event on Thursday, the 29th of February, which will be showcasing the posters that have come in, so do make sure to get them in, but also reflecting on all of the learning and knowledge, because there'll be so much to take from this 4 weeks of incredible sessions. And all of the sessions are going to be recorded and put on our Healthy Brum YouTube account in a playlist, so these sessions will be able to access long into the future with this knowledge and sharing constantly happening. And we have a few sessions that are yet to go up, so we're having them come in thick and fast. That's why I'm encouraging people to still submit their workshops. So we'll be having one on the cultural competency that'll be posted soon, and a few other sessions that'll be coming through. So do make sure to sign up to the event. So you should have been able to access the register here links as you was going through, but you can scan the top QR code. I'm pointing, but I don't know where it is on the screen. The top QR code next to the make sure to check all the events, where you'll be able to find out about all the Eventbrite links and register for what you want to attend, but also keep checking back for the new sessions as they arrive. And if I can also ask everybody as well who attended today's session to complete a bit of an evaluation form. You'll also our test subjects to see if the evaluation form is working, because we want it to be right for the community. So if there's any feedback on the evaluation form, do stick it on there or let us know via email how we can adapt that to make sure it works for all of our community. So just to quickly finish off, I want to say a massive thank you to all of the speakers. Thank you, well, Sue and Lynne, who are not with us, but they'll see it in the recording. I've said thank you again. But also thank you to Steph from Birmingham LGBT, and to Joe from Public Health at Birmingham City Council, and to all of the people that have attended the session today, and to all those that continue to listen to the session when it gets posted on YouTube. And I hope that you can attend as many of the workshops and webinars, or submit the e-posters, or sign up to host a webinar or workshop as part of our very first Pride Well Summit. And hopefully this will be the first of many conferences and workshops and webinars that we'll host in coming years. So thank you, everyone. I hopefully will see you all at one of the events, hopefully on Tuesday, or see you in person if there are any that pop up throughout the month. And thank you for taking part. I'll speak to you all soon.